Hello everyone, this is Dr. Shalini Gupta at the Dermatology Laser and Vein Center. We hope that you are all doing well and staying healthy and safe. Today we thought we will talk to you a little bit about acne scars because it is a very commonly requested problem that we are asked to solve for patients. And when patients call us, they just say, I have acne scars and what can you do for them? Well, in reality, we can treat acne scars very effectively, but it also depends on the type of scar we are dealing with. So some scars are what we call atrophic, and atrophic scars means that they have volume loss under the scar, and I'm going to show you in a minute what the different types of atrophic scars are that we can treat. Scars can also be hypertrophic in the sense that they are elevated off the skin, so those could be even keloids or just bumps on the skin that appear and persist after the acne is gone. And then we have pigmentation issues in the skin. So you can lose pigmentation, you can make pigmentation, which is called post-inflammatory hyperpigmentation, and you can also have a persistent redness to the skin called post-inflammatory erythema. And these are all the different outcomes after the acne is gone that can occur in the skin. And we have different ways of addressing all these different concerns, but the technology and the method we use is going to differ based on the type of scar that it is. So there isn't just a one treatment fixes all types of scarring solution here. And then sometimes we have to combine topical medications or even oral medications if there's still a little bit of acne going on. Some of our treatments will work on both the scarring and the acne. So that's also very exciting, and we'll talk about that maybe in a different video. But today we're just going to focus on the acne scars themselves and how we can address those. So like I was saying, there are different types of scars, and visually seeing them is really important for me to determine what I am going to use to most effectively treat that type of scarring. So on the atrophic side of the scars, we have what are called boxcar scars, which are kind of angulated, almost like rectangular looking scars that dip into the skin with very sharp borders around them. And then we have something called ice pick scars, which are almost like somebody poked little ice picks through your skin and they just look like little holes. And then we have also rolling scars, which can sometimes be confused with the boxcar scars, except they have a much more gentle border, so they do not have a sharp angulated border like the boxcar scars. And then with the hypertrophic scars, like I said, those are the elevated scars. So let me see here if I can show you a little diagram that might help make some sense of it, of the different type of scars. So again, these are ice pick scars where you have little holes throughout the skin, and then these here are the boxcar scars. So again, you can see a very sharp edge around the scars, and then the rolling scars and the hypertrophic scars. And then of course there are the pigmentation issues, the hyperpigmentation, the hypopigmentation, which is loss of pigment, and the persistent erythema. So all of these different types of scars can be effectively treated. For ice pick scars, if we start with that, those are the ones that look like little holes throughout your skin. It might look like you have really big pores throughout your skin, and a lot of times the enlarged pores are just acne scarring. So those can be treated with a method called cross TCA, and that's where we take TCA, which is a peeling agent, at a high concentration, and we take a little toothpick essentially and put this TCA medication right into the ice pick scar. Now it does take several treatments, but over time it really helps to bring the base of that scar up higher so that the scar depth is reduced, and that makes a pretty significant difference in the overall outcome. And then with the boxcar scars, sometimes if they're large enough or broad enough, we might suggest doing an excision of those scars and resuturing the skin to get rid of some of the really large, broad areas. And with the rolling scars, fillers can sometimes be a really good way to fill those in. And a filler like Bellafill, for example, which will last 5+ years and stimulate your own collagen, can be a really nice, effective way to make those scars less apparent over time. In all of the atrophic scar situations, I love to use our technologies. We like to use laser, we like to use fractional radiofrequency, fractional lasers like Fraxel laser itself, which is a brand of laser that is FDA approved for this kind of scarring. We also like to use the fractional, which is a fractional skin resurfacing laser, which can be used also in a continuous mode where we just take off layers of the skin, almost like shaving the skin off. That has a bit more recovery time, but can give really dramatic results in patients who need that. And if we don't want to have as much recovery, then we can use the same laser in what we call a fractional mode. So it's actually treating a fraction of the skin by poking little holes with the laser throughout the skin to create islands where your skin is going to heal itself, generate new collagen and elastic fibers, and make those scars less deep, more shallow, and over time give a smoother appearance and more confidence to you. And the other method that I like to use a lot of times in these types of scars, because some of them are really deep, especially if you've had cystic acne, and it's almost like your skin is just a deer. It's like stuck down to the tissue underneath. And so using a method called subcision with a needle, where I can go under the skin and break that scar tissue up before we use a filler, before we do a skin resurfacing procedure, can be extremely beneficial and give much better results to the final outcome. With the hypertrophic scars, I usually like to use a laser to flatten those scars down. We can also sometimes inject them with a steroid like Kenalog to help them shrink down. And sometimes a surgical excision is just warranted, where we might cut it out and restitch it or just shave it off. So those are the different methods for the hypertrophic scars. And then with the pigmentation issues like hyperpigmentation, and we commonly see that, especially a lot of times in our darker patients. But luckily we do have lasers, we have peels, we have topical treatments we can use, a lot of times in conjunction or in combination, to give the best results safely for all of our patients. So those can also be effectively treated, but it's going to require a different type of laser, different type of technology than our atrophic or hypertrophic scars. And then we have the persistent erythema, where there's just redness that won't go away. Again, our vascular lasers can be excellent for that. Those patients who have lost pigmentation and they have white spots on the skin, what we call post-inflammatory hypopigmentation, that can also be effectively treated with our fractional lasers like Fraxel, fractional radiofrequency, fractional, and microneedling as well. I did forget to mention microneedling as a very good treatment option as well for all of the atrophic scars. But usually if we use a laser technology or a radiofrequency technology in a fractional manner, it's sort of like doing microneedling, but with energy. So it just depends. In some cases we will recommend microneedling, in others we highly recommend the lasers. And then there's a little difference in cost also between the different procedures. So sometimes that determines which route a patient would prefer to go on the treatments. So that's a little bit about acne scars, the different types of scars, and how we would approach it. And I hope this was somewhat helpful as you think about how you want to approach your skin and what's going to work best for you. Of course, it's best to come in for a consultation so we can really determine and customize a plan for you. And we can also do virtual consultations, and I would love to see you and talk to you and get you your confidence back. So stay healthy, stay safe, and we'll see you soon.